What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those who are new to the channel, my name is Dr. Antonio Webb, a fifth-year orthopedic surgery resident. In this video today, I'm going to be talking about some mistakes that I made throughout my residency training. Depending on your specialty, whatever specialty you go into, emergency medicine or internal medicine or surgery, your residency can range from anywhere between 3 to 7 to 9 years of training. So it's a very long time. And so a lot of people don't know this, but the word residency has reside in it, which means that you reside in the hospital. So you work a lot of hours during your training that loud music is very unnecessary. So you work a lot of hours during this number of years. So for a surgery resident, you can expect to work up to 80 hours per week, plus hours, which there's a lot of rules and regulations in terms of working any more than that. But you will be at the hospital a lot. You will essentially live at the hospital. So that many hours of being at work and that many number of years, you're going to make some mistakes. And I made lots of mistakes over these last 5 years. I am nearing the completion of my residency with less than 2 months left. So I just wanted to look back over the last 5 years and look at some of the mistakes I made, and hopefully you guys don't make these same mistakes. So I would say the first thing that I can think of, and the first mistake I have made during my training, is that I didn't really realize that you had to study every day during your training. So coming into my intern year or my second year, I would just go to work and then get off and just do whatever. Go out with friends or go work out. I didn't really put in the time, and I didn't really read every day. And that's one thing, looking back, that I wish I would have did or started a lot sooner, was read every day. Even though you're working up to 80 hours per week, you still have to come home and study, because we still have exams during residency. And every year we take an 8-hour, it's called an in-training exam about orthopedic surgery. So how to treat patients with fractures, how to perform surgery, the relevant anatomy, histology, microbiology, all that stuff. So looking at histological slides and gram stains and what antibiotics to give patients, all that stuff comes into play. So you have to read, and you have to read every day. So that's the reason why training is so long, because there's so much information to know. Just like a NBA basketball player or NFL player, they're not good just because they just showed up to play. They work out every day. They do things to be successful, put themselves in position so that they're successful. So make sure when you start residency that you read every day. You do some questions, practice questions, and you just stay on top of it. So the second thing that I realized, the mistake that I made, was that I really didn't prepare ahead of time for the upcoming interviews for fellowship. So as a resident, depending on your specialty, if you're internal medicine, you may apply during your 3rd year for fellowship, if you're going to do one. Fellowships, for those who don't know, is an optional year to subspecialize in your specialty. I'm doing spine surgery, so during our 4th years, usually a year before you graduate. So during my 4th year, I applied to fellowship for orthopedic spine surgery, and then you go on interviews. I went on maybe, 9 or 10 interviews maybe, and it was expensive as hell. It was a lot of money. It was about $5,000 or $6,000 from the flights, from the hotels, from the Ubers, the food, the application fees. It adds up. So the mistake that I made was not kind of preparing for this. And what I would probably recommend is that you put money aside each month, starting in your intern year. Just put, $20 aside. At the end of that year, that's what, $200-300. By the end of your 4 years, you may have, $1,200 or $1,500. So just put some money aside. Even if you put $50 a month, that's $600 a year times 4 years. That's almost $2,500. So that's about half of what you'll need to pay for your your interviews and flights. So just prepare for it, save up for it. That's another mistake that I made. The next mistake that I made was also thinking about my current situation, not preparing for the interim between when residency ends to when like fellowship begins or a new job begins, or if you go out to the workforce. If you're going to do a fellowship after your residency, you finish like in June 30th or something like that, and you don't start fellowship until August, because you have to take your boards, you have to move and all this other crap and credentialing processes for the hospitals you'll be working at. So you won't get a paycheck during that time. So that's almost 6 weeks or 8 weeks that you will not get a paycheck for 2 months. And you have to take that into account, especially if you're doing a fellowship where most fellowships start August 1st and then you finish residency, end of June or July 1st. So just keep that into consideration and plan ahead for that. The next mistake that I would probably say I made over the last 5 years is that I showed up a lot of times to surgery unprepared. As a surgeon, you operate a lot, especially in your training, and you're trying to learn not only the pathophysiology of what's going on. Say, for instance, someone has a arthritis in their knee. You have to know at a molecular level or a cellular level what's going on with that with the cartilage and what happens, what leads to arthritis, and then you have to be able to recognize it in clinic. You have to be able to indicate a patient, which means know when a patient is ready for surgery and it failed all of their conservative treatments, and you have to know how to do the surgery. So it's very multifactorial, it's very complex, and there's a lot of times during my residency where I just showed up for a case and didn't know really what was going on, or didn't know the steps of the surgery, didn't know my anatomy. Those are big no mistakes, and that was kind of earlier on in my kind of training. And then after getting disciplined several times about not showing up, or some surgeons will even yell at you at times for not knowing the questions that they ask, it made me go home and read or study harder and make sure the next case I was prepared for. So you have to read, and you have to be prepared. And if you're not going into a surgical specialty, just internal medicine or pediatrics, you have to read up on your patients. You have to know your patients, know their condition. If you're going to present to your attendings during rounds about a patient who has some type of tumor, you need to read up on that beforehand, and then make sure you know what you're talking about when you're presenting. So it goes for all different types of specialties. I would say the last mistake that I made, is kind of in this current situation also, is being too comfortable as a chief resident. After all these years and all the surgeries I've done, over maybe 2,000, 2,500 surgeries during my training, there's still gonna be some things out there that you just don't know or just not comfortable with. So it took me a while to realize that you're not going to learn everything. You're not going to know everything by the time you graduate. Medicine is a lifelong process, and it's continual learning. And that's the reason why surgeons who are out of practice, or doctors for 20 plus years, and they're still learning, still going to conferences, still reading articles, still reading textbooks. So the mistake I made was going into my chief year and was like, man, I'm the boss. I know everything, but that's not true. I don't know everything, and came across a whole bunch of situations where I got very humbled by not knowing something or not knowing how to do a particular surgery when I thought I did. So just stay humble, keep reading. Medicine is a lifelong process. It's a long journey. Take it day by day. Make sure you read every day. Make sure you're prepared to go into the hospital when you're seeing patients each day, and have fun. It's a long road, but it's definitely worth it in the end. Thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.